Now, vaccinations are crucial for individual and community health. They help prevent serious diseases and contribute to herd immunity. They save lives, reduce the spread of infectious diseases, and are cost-effective public health interventions. Nigeria is vulnerable to infectious diseases and has continued to sensitize the public on the importance of vaccination. But how has the response been like? And are critical stakeholders doing enough? One of these stakeholders will speak on the spot on the importance of vaccination. I am Joseph Oten. Welcome to the program. Now, my guest is a health advocate and gender expert with over 14 years of experience in immunization, public health, gender research, and social development. She is a recognized leader in the development sector and civil society space. Her core areas of expertise include community mobilization and engagement, inclusive program design and implementation, gender programming and analysis. On the spot is founder of the Vaccine Network for Disease Control, Chika Ofor. Welcome to the program.
Thank you very much. It's a great honor to be here.
Okay. You are even called Mama Vaccination. That's
yes.
what I understand.
yes.
Vaccination, of course, nobody can overemphasize the importance of vaccination in terms of preventing a disease. But in Nigeria, we still talk about vaccination. In other places, people don't just talk about it. It's like it's a normal thing now. But in Nigeria, we are still drumming it. As a matter of fact, at the World Health Assembly, the Minister of State for Health and Social Welfare spoke about the government commitment, where he said government have approved over 20 billion United States dollars to inject into healthcare, especially this issue of this overseas countries cutting out the interventions, especially in Africa, Nigeria, and so on. And speak to us. How important of this kind of investment? Let's react to that.
Yes. Vaccines are miracles, and that's the truth. It's a preventive approach to make sure that you do not get the disease. And today, we don't talk about smallpox because of vaccine. I'm sure you didn't even meet smallpox because of vaccines. So it's not something that we need to convince people to take. Ironically, it's based on trust. Because you're taking medicine when you're not sick to prevent the disease that may come. That's what vaccines are. And because of that, it is important that people understand about vaccines, the value that vaccines bring, trust the vaccines that are available, and make sure that the country must make sure that all those that need vaccines get them. For instance, in Nigeria, we have over 7 million children that are born every year, and those children need vaccines. Nigeria has also introduced new vaccines, rotavirus vaccines. In fact, HPV vaccine was just introduced. They are about to introduce measles and rubella. All these things require funds. So the first thing, na money na make your float. That's the truth. So even as I'm talking to you about this vaccine, the first thing is for the availability of the vaccines. As I'm talking to you today, the 2024 budget for vaccine procurement, that is the budget, domestic financing for vaccines, 2024 that has been appropriated, only 25% have been provided. The amount of money is simple. The balance is about 108 billion naira. It seems like a huge amount, but when you look at the children, the number of individuals that need this, over How many millions? The children alone is about nearly 8 million. The young girls that need HPV vaccine, we've already vaccinated about 13 to 14 million.
When we talk about vaccine around this year, but a lot of people think of vaccination as this is for the kids. The adults don't even think about it.
Yes, there are vaccines for
everyone.
Is it
because of the unavailability or what?
No, so we have what we call the routine vaccination. The routine vaccination is what you give free. So we give free to our children between the ages of 0 and 1. So, and there's so many vaccines in that pool that we give free. And then now we give free vaccines to young girls between the ages of 9 and 14. So many times we focus a lot around those free vaccines. That's what we want people to take. Let's start from there. There are so many vaccines to prevent so many diseases. But our focus really is on these ones that are free, that the government has provided. We want people to take them so that their lives will be long, so that their lives will be well. Can you imagine? Right now we are celebrating that polio, wild polio virus is no more. It's because of vaccine. That's what we are talking about. These vaccines have to be purchased. And then they have what they call from pot to arms. From the pot to the arms. It gets only to the pot when you have paid for it. It gets to the arms when the people believe in it.
Talking about people believing in it, what is the response? Like, you have been on the field.
Yeah.
You know, in the past we have resistance and so on. What is the level of vaccine resistance down in the country? Do we still have vaccine resistance?
Yes, of course. We have, right now, the coverage is 53%. That is the vaccine coverage based on the survey that was done. So there are different reasons why people don't take vaccines. Many cannot be helped. In all those humanitarian settings where you have insecurity, it's difficult for the vaccinators to go there, to get there. So they have to ring fence it at a particular time, bring soldier police, do the vaccine, and then
these are the people who even need it the most because they are vulnerable to a lot of diseases.
And then some people also do not take vaccines because it's not near where they live. As simple as that. Some people based on culture. There are so many reasons why people don't take vaccine. Some because they forget. You know? So there's so many reasons why people don't take
But that's
vaccines.
where people like you who are advocating for this. Will you now challenge yourself that you have done quite enough or well?
One group.
Because we still have a huge gap.
Yes. It's a huge gap. It's work in progress. It's work in progress. Every year new children are born. Every year strategies have to change. Every year. One thing I want to say is that one person or one group cannot do it alone. I'm
not talking about just you. I'm talking about people like you.
Yes.
Even your collaboration and so on.
Yes. Our collaboration. What I mean by one group cannot do it alone. CSOs, I represent the CSO group. CSO cannot do it alone. Government cannot do it alone. PPP cannot do it alone. Donor partners cannot do it alone. All of us have to come together. And everybody has a role to play. In terms of demand generation, that is advocating at the community level. CSOs are the nearest to the community, so it's easy for them. And it keeps improving. We keep improving. And let's not forget that every time they introduce new vaccines as well. The government, their own is mostly governance, to make sure that all the policies, processes, things that need to be in place. We thank God for the Minister of Health that we have, who was from the development space, who has also worked in government. So he's not new. He knows what those challenges are, and he's working very hard with all of us to make sure that those strategies, he has the swap strategy, he has the blueprints that he has the MAMI. These are all strategies to make sure that Nigerians are healthy. And vaccine is one of those things that will make Nigerians healthy. So all hands must be on deck, and we are still working. People are advocating. CSOs advocate at the highest level to make sure, like I'm talking to you now, about the fact that the 2024 budget that has been appropriated, the money has not been released. I'm a CSO, so I can say it. And I'm saying it clearly. For 2024 and then 2025 also, as well. And then because of that, we cannot afford any stockage or stock out. And that becomes imminent if these things are not provided. USAID and many other international donors are leaving. Yes, we'll take charge of our vaccine story. I don't think Nigeria cannot take charge of our vaccine story. We are a strong country.
As a matter of fact, that's what the government talking about the investment.
Yes.
I have the privilege of hosting the the man in charge of the primary healthcare.
Okay, Dr. Muyi.
Dr. Muyi Aina.
I know.
And he spoke more much about that investment, and as a matter of fact, he said the foreign donors pulling out will not really affect the country because of the huge investment the government have done. But apart from the government investing in that, you just talk about what the CSOs could do.
Yes.
Taking it to the grassroots.
Yes.
And that's where a lot of people question that most of sensitization sometimes are done in the cities and towns and so on. Getting to the grassroots, how much of this you've been doing? Because this is where the public needs you even the most.
Yes. When you say civil society, there are so many of us. We have the faith-based organization, we have the community organization, we have different kinds of organizations at that level, and they're working. They're working to make sure that vaccines get to all that need them. So I cannot even say that CSOs are not working. CSOs are the grassroots. That is why they're bringing us to the table. If CSOs were not important, they would not be bringing CSOs to the table. So I say it very clearly today that CSOs are working at the grassroots level to make sure that they sensitize, they mobilize, and then they see the problems that are being faced, and they bring it to the top level and say, these are the challenges. And one of the challenges is that at the community level, many people at the community want to be part of the designing of whatever strategies that you're bringing to the community. You cannot bring something and come and put it on my head and say, go and take vaccine. No. And people have realized it. The government has realized it. That is why they are now bringing the community to the table, bringing CSOs to the table, bringing everybody to the table. So as we plan, as we design, everybody is bringing their ideas. And different little innovations in different localities is what is happening. So right now, there's improvement. I'm very optimistic. I'm a full Nigeria. I'm very, very optimistic that it's going to get better. Now we are taking charge of our vaccine story. Domestic resource mobilization is the key. At the community level, sensitization, bringing everybody on board. It wasn't like that before. But now it's happening like that. So I'm excited. And I know that it can only get better. And then it's not only vaccines, it's cross-cutting. At the primary healthcare center, you have different approaches. Like there was one that the government did called the whole family approach. That thing really excited me during the COVID-19 time, which is you see going to the health center as a family visit, where the health center is a one-stop shop, where the father can go and check his BP, the mother will check her reproductive issues, the little girl of 9 to 14 will go and take her her HPV vaccine, then the baby, they will carry the baby to that one will take his own vaccine. It's called the whole family approach. It is exciting. And I am propagating, I'm advocating for that strategy so that the father will not say, this vaccine are women thing. That kind of thing. And maybe by not provide the small transport. But when you know that he has something to gain, everybody has something to gain at the primary healthcare center. It's exciting. It is an incentive that isn't money. So these are the kind of things. But for that to happen, the health centers have to be equipped to make it a one-stop shop. For the health center to be equipped with everything, vaccines and every other thing, funding has to be provided. So these policies, the government have provided a lot of policies, innovations, governance strategies to make sure that these things happen. CSOs are there to push to make sure that all these things happen. The private sector is also there as well. The community are also there. And the CSO also act as accountability. Where it is not working, they will say it is not working here. That money, especially for something like logistics, vaccine logistics, vaccines have to be carried from, once it gets to Nigeria, it has to be carried from the vaccine store to the state. When it gets to the national provides for it. But from the state now to the primary healthcare center, strategies are being developed even as we speak. Those things have been identified as challenges and everybody is working on them. All hands are on deck because I'm part of that. I'm a Nigerian. You too as media, you are not left out. You are part of it. All hands on deck means all hands on deck. Nigerians will survive. Our children will live. Whether there's donor funding or there's no donor funding, we will take charge of our vaccine story.
Okay, another issue that have been just take a breather, and then when we come back, we'll continue with the conversation. Do stay with us as we take this break.
Advertising your goods and services on the right channel gives you an edge over your competitors. NTA News 24 has all the platforms for your target audience. With our digital format and wide range, we can reach your customers in next to no time. We are eager to promote your business, goods and services. So, partner with us for a very rewarding business experience. For more information, please call or visit our office at NTA Headquarters, Area 11, Garki, Abuja. NTA News 24. News and more news.
Welcome back to On the Spot. We are discussing vaccination,
Yes.
the importance of vaccination. And Mama Vaccination is here herself. Okay. During the COVID-19, the world was shocked how vaccine hoarding became an issue. And that's where, especially for countries like in the African continent, where they were relying heavily from these foreign vaccines, it became an issue for them. Thank God the COVID thing didn't hit Africa that much. But that drew the attention of a lot of leaders and stakeholders in the African continent that we need to do something.
Yes.
Vaccine manufacturing.
Yeah.
But it seems up to now we have not heard much from that. It's like after the COVID thing, it's like the noise is going down. You should be the one
Yes.
having the louder voice there,
Yes.
trying to remind them that look,
Local vaccine production is
before
important.
another COVID coming, you need to do something.
Yes, that's a very good question, and I'm happy you. I just wanted to also say that during the COVID-19 time, Nigeria also did a lot. We had a group called the CACOVID, private sector, who came in and supported the distribution of the COVID-19 vaccine. They did a very good job. So it shows you that Nigeria was on top of our game. We are not where we are supposed to be, but we're not where we're coming from. And also, local vaccine production is something that, whether we like it or not, it has come to stay. Right now, we have different organizations coming together, and our Honorable Minister of Health and Social Welfare, Professor Patti, is also aware, and it's part of his agenda. Local vaccine production is one of them, and not just local vaccine production, also production of drugs. And they are doing a lot around it now, bringing it, but it is not yet open. There are a lot of planning. Vaccines are not jokes. It's not something you say because this country is doing it, Nigeria will just jump into it. It's a very sensitive thing. You're giving it to newborn children. So the planning, the designing, the sensitivity of it is on board. I can tell you for free.
Okay, there's a lot of people are displaced.
Okay.
It seems, before we forget them, if you go to most of the crisis-affected areas,
Yes.
when you go there and you see the conditions of things, that you know that we have a crisis here.
Yes.
How much of the advocacy have you been taking to these affected places?
That is humanitarian settings.
Yeah.
Yes. There are CSOs.
We have a lot in North Central, we have
Yes,
in the Northeast, and
yes.
so on.
Yes. In North Central, we also discovered many slums. We also, as an organization, but we're not the only one. There are many CSOs working in those places as we speak. There are many different slums, even in FCT, North Central, Nasarawa. Even one of our projects on malaria was one of those kind of settings in Nasarawa State. Even in Delta State and many other states. But we are just one organization. But I can tell you for free that there are many CSOs working in that space. There are many community-based organizations.
Are you impressed with the coverage?
The coverage for the vaccines?
Yeah, in these affected areas.
Yes, it depends on what is affecting the area. You know, like have you forgotten that there was a time even the health workers were killed? There was I can tell you now, in Delta State, Warri, my colleague was killed. He was killed by insurgents on the road, kidnappers. When we were going to do our work during the COVID-19, nobody was moving on the street, but we were moving. We were supporting. I was actually supposed to go with him on that trip, but my husband had COVID. So I had to stay with my husband. He went alone, and he never came back. Yahaya never came back. He went to do work, to sensitize, to support, to help communities, and he was killed. So many CSOs have been killed in the process, but we're still there, hanging in there. Many government officials, health workers have been killed. They're still there, hanging in there. We've not given up. So people are working. People are doing what they're supposed to do. But what I'm saying is all hands, is work in progress. We need to do more. I'm not in doubt about that. But people are working.
The people trusting not just the vaccine, but even the people bringing the message. Even there are some places that don't even trust the civil society organizations that are bringing the sensitization. They feel that sometimes the civil society are just for their own personal interests, and they are just pursuing their personal interests. What is the gap there now? What is the major challenge there, and are you bridging that gap in terms of gaining the public trust?
Yes. So public, it's not only CSOs that are there to gain trust. Every community is different. For instance, let me give you an example. Where I come from in Imo State, whatever it is that the priests say is believed. So in that particular instance, the priest becomes a trusted voice. In some other communities, it's the health worker that is the trusted voice. The people that they trust, the nurse Eliza, the nurses that they meet on a regular basis are trust. So different locations. Then you have the faith-based organizations. They are also trusted voices. You have the emirs. There are different groups at different levels. Then CSOs are the ones that are able to aggregate all these things, all these people together. And at the same time, they are at the community level to say, in this particular area, the trusted voice is the health worker. In this particular location, the trusted voice is the emir. In this particular location, the trusted voice. These are the kind of analysis that is done. So let me just mention something. Even the parliamentarians, their oversight function is also key. A parliamentarian can go to any length to campaign for his position when it's time for campaign. The same parliamentary, their oversight function. And many of them, like recently in one of our projects by Global Health Advocacy Incubator, we took parliamentarians to Turkey. Not only our own Nigerian parliamentarians from 10 countries all gathered together to develop approaches that will make sure that financing for vaccine is catered to. And their oversight functions also, forming a caucus, putting their boots on the ground, knowing what is happening in their community when it comes to vaccines. And at the end of the day, educating, sensitizing, mobilizing, all these things were done. And now we have come back from Turkey. And guess what? The boots are hitting the ground. Now that the rubber has hit the ground, everybody is excited and they want to work. And we are aligning it to their success story. Election is in 2 years. Your success story will be how many lives are saved in your community. All these things are working. These are innovations that are being put in place, So everybody's working. And CSOs are really working.
Everybody's working.
Yes.
Okay. Briefly now, how important is the vaccination to the well-being of the society?
Yes. I'm a literature person, so let me start from that level. Eneke the bird says that since men have learned to shoot without missing, he has learned to fly without perching. Since diseases have learned to come without notice, vaccines have learned to prevent those diseases through that same prevention. So that is one thing, vaccines prevent diseases. And the flow is that those vaccines for now must be purchased. In the long run, local vaccine production is important to reduce cost. They must be purchased. The 2024 budget the money must be released to buy vaccines so that there's no shortage. That for me is what I want to talk about. And 2025 is very, very important. There can be stock out because you cannot be telling people to come from their houses to go to the health center and there won't be vaccines there. They won't come again a second time. So that is critical. And then trust is also important. My dear brother, all hands are on deck. All hands should continue to be on deck. We must work collaboratively to make sure that vaccines get to all those that need them.
Thank you so much. Chika Ofor.
Yes.
Founder of the Vaccine Network for Disease Control.
Yes.
Thank you for being on the spot.
Thank you very much.
It was very informative. And thank you too for watching. I'll see you on the next episode. Goodbye.